Do you have any comments? Come here, sir. I need a chip or something. All good, no worries. Okay, so do you know what endometriosis is?
No, I have no idea.
No idea. No worries. Have you ever heard of that word at all?
Not until you just said it about 3 seconds ago.
Yeah?
No?
Okay.
It's something to do with the lining of the uterus.
When the stomach lining gets infected and sort of goes with...
Endometriosis. It sounds familiar. I'm not going to try and answer that because I don't really know, but...
Isn't it? Is that something to do with the inflammation or something?
It starts in the uterus and then it can sort of go to different parts of the body.
But yeah, I am aware of it. After you clarified it a bit, I did know what it was.
Yeah. Do you know anyone that's impacted by endo?
No, I don't think I do, no.
Yeah.
Not that I know of, no.
I'm sure there's people in my life that are. They probably just haven't disclosed it to me.
I've got a few friends at the moment that are going through the decision to go through with surgery to work that out.
Yeah, I've had 2 friends who've had endometriosis. Yeah.
I know that it's very hard to diagnose.
I know that there's a poor diagnosis. Patients find it hard to get diagnosed with it because doctors aren't willing to diagnose it, is that right?
Yeah, it takes a while to get to that stage, by the sound
Exactly.
of it. Okay.
I'm not really disappointed by the reaction because it's just what I expected. And maybe I'm a bit desensitized to it, because I've been working in the advocacy space for endo for a couple of years now. I can't really expect other people to know. And also, I don't really blame the public for the fact that a lot of them don't know what endometriosis is and they have the wrong idea about what it actually is or how it works or how people are impacted by it. I mean, the first 20 years of my life, I didn't even know what endo was. So for me to ever have optimism or trust when it comes to the medical system in Australia, the government, and people who really have the power to control and make change in this area, it's going to take a lot. We need a revolution. We need a fucking revolution. We rolling? My name is Naomi. I'm 24 years old. I live in Melbourne or Naarm. My journey with endometriosis starts when I was about 14 years old, when I first got my period. I was experiencing really severe menstrual cramps and it was really consistently affecting my ability to function throughout my day. And so I received medical attention pretty much straight away. I was told that I just had a bad period, and that's just what periods were like. I was just told that this was normal. I think that that's almost one of the most standard things that we are told as endometriosis patients before we're diagnosed and even after we're diagnosed. I was put on birth control. I was told that that would help regulate my period, and that was why I was maybe experiencing such bad cramps. I think when I was about 21 was when it became more serious and I had to seek further professional opinion for my periods. I spoke to a doctor in my family and they referred me to see a gynecologist. It was at this appointment with the gynecologist that endometriosis was first mentioned to me at 21, which is 7 years after I first experienced any symptoms of endometriosis. And 7 years is the average diagnosis time that it takes for someone to be diagnosed in Australia. Once they mentioned endometriosis to me, I felt a sense of relief that there was possibly something that could have been causing this pain, because I had only been told that this was just normal and this was just what periods were like. This was the first time any medical professional had said to me that there could be a cause for the symptoms that I was experiencing. So they suggested doing a laparoscopic surgery to investigate, but because I wasn't convinced that I actually had anything, and because I also had never really heard of endometriosis, I was really going in pretty blind and pretty ignorant towards the disease. And I decided to just throw myself at the opportunity of getting a surgery publicly. I'm really grateful that we have a public healthcare system in Victoria, but unfortunately my experience of that surgery wasn't very positive. Going into the surgery, I think I was experiencing pretty debilitating pain for maybe 7 days of the month. Within 1 to 2 months after that surgery, it was at least 20 days of the month, which was pretty devastating. And it was also pretty shocking because I wasn't expecting to try and receive medical attention and treatment for this disease and then be left in a position that was a lot worse than what I was in before. There was not a lot of aftercare. I wasn't really taught a lot. Every medical professional that I had seen after my initial surgery told me that I had stage 1, they removed all my endometriosis, they found everything, so they really didn't know what could still be causing this pain. So I was left in a position where I basically had no options, and this made my mental health plummet really severely. I ended up being admitted to a psych ward because I wanted to end my life because of how severe the pain was and how helpless I felt. Going online and talking about what I was experiencing was a way to feel like I had someone to talk to about it, but also it ended up being a way to learn about the disease. I tried to find an expert excision specialist in endometriosis. I couldn't find one that I was confident enough in to see in Melbourne, so I flew to Sydney to see a specialist. It was the first time since my initial surgery that anyone told me that they think there could still be a possible cause for the amount of pain I was in, and it was the first time I had felt a sense of hope again. I had this surgery and I was diagnosed stage 4. So within less than a year of my initial surgery, I went from stage 1 to stage 4. I still don't know if that was just the amount of endometriosis growth I had in that time period, but I'm more inclined to believe that it was more a matter of the first surgeon I saw wasn't well trained or equipped enough to be able to identify my endometriosis. Every single person and endometriosis patient that I heard from and that responded to my videos, it was almost like we were all following a script of our experiences. Like, it was uncanny. And I realized that this was a lot bigger of an issue than I originally thought it was. We are on the way right now to go and see Tish, who is an incredible endometriosis advocate and patient. We're going to talk to her about her perspective, living with endometriosis, dealing with treatment in Australia, her experiences of that. I'm really, really excited to speak to her. We have a little bit of a journey ahead of us, so better get going. Tish, thank you so much for joining me today.
Yeah, of course. Yeah. Thank you for having me.
We're here to talk about endometriosis, obviously. You are an endometriosis patient.
Yes.
Do you want to go back a little bit? When did your endometriosis symptoms start?
Well, I presume from my first period probably was when the warning signs began. Mm-hmm. I went throughout my teens thinking what was going on was completely normal. So I suspect I've had it since my period started.
Yeah. And when did the symptoms start getting to the point where you realised you needed to, seek medical attention for them?
Probably about the second year of university, when things started to become debilitating, to the point where I was taking time off uni, time off work, couldn't get out of bed. I pursued a diagnosis, but because I also had GI symptoms, that then created a confusion, and they focused there instead of on suspecting anything to do with my period.
Right.
Yeah.
So it was kind of neglected and missed.
For a long time, yes.
Yeah.
Misdiagnosed with polycystic ovarian syndrome for a while. Then, IBS because of the bowel symptoms. And they even took out my gallbladder just because they found a little bit on scan, a little bit of sludge in the gallbladder. So they removed it thinking, yes, that is the reason for your pain, pelvic pain, that's the cause.
How long do you think you were going through that process of misdiagnosis and other conditions being thrown around before endometriosis was actually mentioned to you?
It was about 12 years. It got complicated because they did do a lap and they did find endometriosis. But in the same breath, the doctor said, it's not endometriosis, this is stress. You need to quit your job. And we've lost the images from your lap. So I never got a report. I never got the photos from that first surgery to know just how extensive it was. But then in 2 years later, I was back in hospital in pain. They said, let's do another lap. This time I said, I want to choose my doctor. I had a friend who had a similar diagnosis, very different presentation, but went with their surgeon, and she did the surgery and woke up and she said, no, this is very much endometriosis and needs treatment. And I think that is when I officially got diagnosed.
Yeah. Wow.
So that was in 2011.
And with that first laparoscopy that you had, where they did find endo, was that confirmed in pathology, or was it just
They
a
said it
visual
was.
confirmation?
They said it was.
And then they still denied.
And then they still said, it's not this, you need to quit your job, it's stress, you're in a very stressful career. And I just was so confused because you want to trust your specialists, you want to trust your doctors. And where they found it on the bowel, you know, it wasn't just found in my pelvis. So,
so that by that point it was already extrapelvic and...
it had already spread, so yeah.
Why are we experiencing so many patients needing to have reoperations and not getting the quality of surgery they need from the get-go?
So that's a very important and a very expensive question where you have to understand that endometriosis surgery, what it's evolved to, is nowhere close to where it's supposed to be if you put it in the spectrum of modern medicine.
How many patients do you see from Australia, do you think?
I would say at least one patient a month is what I end up operating on. I end up consulting maybe at least 3 or 4 every month.
Wow. Yeah, that's a lot. Why do you think you are seeing so many patients from Australia needing to come to you?
The gynecologists still believe that even if you're a great laparoscopic surgeon, that endometriosis is part of their armamentarium of things that they treat, which is in itself wrong.
And do you think that that is, I mean, one of the leading causes of why endometriosis is so behind compared to other diseases?
Precisely. You could probably count on all your fingers and all your toes to find doctors across the globe who say, okay, I only do endometriosis. Whereas like you see something like some people who will do only IVF will do only IVF. People who do only gynae oncology will do only gynae oncology. But for this disease, surgically, or even to get to understand the disease, is more difficult than any of those subspecialties. Yet it's not getting the recognition it deserves as a subspecialization. So I made the decision very early on that I will only do endometriosis. It's a risky proposition for most young surgeons coming in. Like, oh, I'm going to shut down 90% of my other practice just to focus on one disease. But this is the kind of dedication that this disease needs to be able to provide any level of competence and proficiency that the patients need when they're having these surgeries. We see a lot of patients even being talked out of having surgery because somebody may deem it too difficult for themselves to do, rather than saying, okay, but I know someone who can do it. Or maybe you could look elsewhere as someone who can do it. I've had a patient who's flown in from Australia who was told that she would die on the table if they operated on her. Wow. And it was not even that difficult a case.
Wow.
But she was really apprehensive. Of course, if a medical practitioner has told you you're going to die on the table, no matter who your surgeon is, you're still going to be very apprehensive at the back of your mind. It was not one of those cases where we were worried about a death on the table, of course. Wow. But that kind of gaslighting of patients really needs to stop.
Is my necklace going to be an issue with the mic? It's behind it. Okay. All right, just telling Donna to jump in whenever she's ready. Cool. Now we wait. She's in, guys. She's in. We're ready.
When I started Endometriosis Australia, the whole industry was getting less than $700,000 annually to research. That was Australia-wide. Since 2018, we've had, I think we're probably in excess of 200 million now.
Wow.
So that's since 2018. So whilst on the ground, the patients are living, walking and talking it today, feel like nothing's changed, so much has changed because 50% of the population knows what endometriosis is
Yeah.
if you say the word.
Yeah.
They may not understand it, but when I started, no one knew what it was, let alone say it.
And what do you think, from your perspective, is one of the biggest reasons why endometriosis is so behind when it comes to that funding and research?
It's a woman's problem. It's a female problem. It's misogyny. And also it's not sexy. Like, breast cancer got ahead because men have a vested interest, I feel, in
Yeah.
breasts, where explaining endometriosis, people, unless they have a fairly decent health literacy, really have a hard time understanding that it's not just period pain. So for context, when this was all happening, there was one little support group that had 20 people in it online and Facebook. That
Wow.
was it. And at that time, I was still having endo surgeries, and I had a major surgery in that time at the early years, and I'd had my uterus removed, cervix tubes, but I'd also had part of my liver removed.
Wow.
And
So you had extra pelvic endo as well?
I have endometriosis in the diaphragm with adhesions to the pericardium, so as well, which is inoperable because of the position that it is. If they went in, it would have a high chance of herniating my heart.
Wow.
And so I would die. So we made a choice that we would leave that where it was and manage the symptoms.
A lot of endometriosis patients in Australia have reported that they've had a lot of issues with finding surgeons that are well equipped enough to treat extrapelvic endometriosis in Australia. What's your experience with that?
I think it's a little misguided because and Australia is leading the world in endometriosis research, endometriosis awareness. So I think there's a lot of disinformation and misinformation online, and it's a misconception that if you remove disease and if you're disease free, that you're pain free or symptom free. I'd like to have RANZCOG recognise a subspecialty for complex gynecology. We have subspecialties in gynecology for oncology. We have subspecialties for fertility. We have other subspecialties, but we don't have something for complex gynecology.
Yeah.
And I think if we had that one qualification, that would then enable patients to have a much better chance of getting the right surgeon and getting the right care the first time round.
You touched on endometriosis obviously being a systemic and inflammatory disease, and there's a big push to recognize it as a whole body systemic inflammatory disease. Do you think that there should be a separation of endometriosis and gynecology, or do you think that it should remain in the same subcategory or specialty?
I think that it still will come under the realm of gynecology because it is tissue similar to the uterine lining. It's not the same, but I think until we know, more information to be able to know how to categorize, I don't think it needs to move. It's still predominantly the burden felt by women and those that were presumed female at birth. So I don't think that we should be reactive. I think what we need to do is be proactive in making it an interdisciplinary care. Mostly pelvic physio works really well for most people. We're getting some more research coming out about acupuncture. We've got things about medicinal cannabis. So I think we just need to have a lot of tools in our toolbox, and the more evidence we can gather for those different modalities to support patients that are living with endometriosis, the better it is.
I mean, I guess a part of the concern for a lot of endo patients when it comes to endo being subgrouped with gynecology is endometriosis is experienced by predominantly people assigned female at birth, but it is still tissue that's growing outside of the uterus and outside of, it involves gynecological organs, but it's been found in all parts of the body. And I mean, you experience that too. And there's a concern with sticking too much with that focus on it being a women's disease and a disease of gynecological organs.
As I said, I think with more research we can find, I think that's going to help lead the way. And I mean, no person wants to be pigeonholed, but we know that the hormones play a role. What role? It is still, we don't want to be primarily hormonal treatments because we know that that's, it's limited in effect, but we know that they play a role. And it would be good to be able to have more evidence to make sure that we're not just course correcting and then overcorrecting and then needing to go back.
You touched a little bit on public discourse in the media and misinformation online. Endometriosis Australia as an organisation has been faced with a little bit of public scrutiny from some endometriosis advocates online, and I wanted to touch on some of the issues that has been brought up in that area and give you a chance to respond. And I'd like to hear your perspective because you have obviously a very personal perspective with that. And one of the issues that people have brought up is, the 2024 financial statements that came out. People were, I guess, confused.
I'm not. There's a statement out by the board. I'm not going to get into that because that's not my role.
Okay. Do you have a perspective to share on why they might have been distributed in a way that looked to some people in the community concerning, or do you know if that's going to be changing in the 2025 financial period?
I think that the statement that brought out by the board chair, I think that's what you have to refer back to and understand that financials are a moment in time. So it's not, I'm not going to talk about any of that stuff. And I appreciate that people want to know, but I am in a difficult position as the board chair made the statement and that's what I follow.
We'll jump to something different. There's, been a little bit of reaction as well to some people in the community have felt as though Endo Australia is obviously an organisation that is built for endo patients, and some patients have felt as though they are not being involved in, the planning and maybe the conversation, and when they are expressing their concerns, that they're not feeling heard and they're feeling kind of dismissed. Do you have a perspective on that?
We have things like there are patient advocacy group within the organisation that patients are more than welcome to join. When anything has come out, like the original guidelines, they had been put in Nancy's Nook, they had been put in all through every support group in Australia that weren't affiliated with Endometriosis Australia. So there was always encouraged for people to give feedback. And I don't know whether social media is the area for discourse to have a fight or have, to have a pile-on, or that's why we have the advocacy groups.
I just have one more thing that I'd like to come back to. Obviously, a lot of people are going to the Endo Australia website to gain information, educate themselves about the disease, advocate for themselves. So on the website, there's a statement that says, if pain continues to occur after surgery, this does not mean that the endometriosis has come back. Do you think that a statement like that on the website contributes to the medical gaslighting that patients are experiencing?
No, I don't, because for myself, I had pain afterwards, but I had pelvic pain physiotherapy, and what I thought was ovarian pain, as soon as she touched those muscles, I was like, yeah, that's the spot. And so the pelvic pain physio resolved my pain. And so it wasn't the disease returning, not to say that, 3 or 4 years later that I didn't have it, or 5 years later I had a reoccurrence. But at the time, some people, it's not always going to be. There's other people that have missed diagnosis of other diseases because they've just put it down to endo. It could be endo coming back. And it could be aggressive.
I guess the issue though is that in that section of the website, it doesn't say it could be endo coming back. It just says this does not mean that the endo has come back. And the other thing as well, you said, it could be other diagnosis. There's not really any part on that website that is suggesting it could be other diagnosis or it could be endo coming back.
That's a valid point. I think it's like everything. It's a living a living document, a living website. And I know that they're currently working through the website at the moment, and everything gets reviewed. So thank you for bringing this up, and I will take it to them and I'll put it on the list to be reviewed.
What's your advice for anyone that is feeling a little bit concerned about kind of filtering through misinformation or getting the right quality of treatment for themselves?
Unfortunately, which I would say in endometriosis is a lot of the onus of making the diagnosis has fallen into the wrong people's hands, where it should not be the patient's job to make the diagnosis or to start advocating for themselves. I think in that regard, patient support groups, patient advocates play a great role in being able to streamline those processes and help patients to identify or to discern good information from misinformation.
Yeah.
So that's a great step forward.
What are some like red flags, in your opinion, to look out for when it comes to finding the right specialist for them, or even green flags that you'd look out for when someone who is trying to find the right professional to treat their disease?
For someone who's looking for an endometriosis specialist, first couple of questions should be like, do you do only endometriosis? How many procedures they do every year? How much advanced disease they do? Do they do everything themselves? Do they work with a multidisciplinary team? How much of the decision making is theirs when they're going into the surgery? You have to be able to kind of not get bullied by them. Yeah, it's a very, very difficult battle for patients. I don't know what the right answer for this is.
There's a lot of responsibility that's put on patients when it comes to their own pain and experiences of their symptoms. And I think that there's a real issue there. I think that patients should be able to trust medical professionals to be able to really teach them and inform them how to treat this disease, and it shouldn't be the responsibility of patients to have to continuously advocate for themselves and, you know, sift through years of medical gaslighting in order to finally get to a point where they are being diagnosed and where they are well informed enough to be able to find treatment and experience better circumstances.
You want to try and, you know, have a silver lining to this kind of horrid trauma that we experience. And if that can be that we stop the pain for other generations or for other people and have more positive outcomes, then I'm all for that. I don't want anyone to be as scared as I was. I remember those nights in hospital when I was alone and afraid. Because of the whole gaslighting thing, you do ask the question, am I going insane? And I don't want other women to have to feel that, and I don't want my daughter to ever have to feel that. So I will advocate hard for her, for other women, for other people who ever question, could I have this disease? And hopefully equip them with the information that they need, because knowledge is power, and just because, you know, some doctors might sound scary and might scare you into a corner doesn't mean you need to be afraid. You know, I've always said speak up even if your voice shakes. So